So today's paper has a combination of Jammu Kashmir 2007 MD entrance questions along with the new questions. What is the commonest abnormal site of implantation? Easiest question on the planet, ampulla of uterine tube, which is called the safety muscle of the tongue, doctor. Basically, safety muscle would be genioglossus, which is a fan-shaped muscle as what you can see here. And what is the favorite MCQ which is going to come in the next JKMD 2015? All the tongue muscles are supplied by the hypoglossal, except the palatal-glossus, which is supplied by the pharyngeal plexus, is what you need to basically remember. From there does musculocutaneous nerve originate? This is the musculocutaneous nerve. It originates from the lateral cord. Everything on brachial plexus you need to be 100% sure, doctor. What are the branches that come from the roots? You have the nervatus serratus anterior, dorsal scapula, they come from the roots. And also the muscular branches that go to the scalene muscles also comes from the roots. What comes from the trunk? Suprascapular, subclavius. They are the two important nerves that come from the trunk. Then what comes from the medial cord? M4U, medial head of the median nerve, medial pectoral, ulnar nerve, medial cutaneous nerve of the arm and the forearm. LML Vespa. So lateral pectoral, lateral head of the median, and musculocutaneous are lateral cord. And posterior cord are all rats. Rat runs behind you, posterior cord. So radial, axillary, thoracodorsal, and the subscapular. So a good number of times, any entrance you go, this forthcoming Sunday on 4th we are having Maharashtra State MD entrance. So by 5th we will have by 4th evening we will have the question paper. So we will use it to conduct a mock test on Wednesday, and we will have a discussion on Maharashtra PG Mat. A good around 10 to 15% questions, straight repeats will be there in APPG. Paper out, right? So at least same questions are related, very related topics and questions. So before the state MD entrance of AP, you have already Maharashtra, Tamil Nadu, JKMD, 60% of the questions we will have a discussion indirectly, right? So that's the plan. Now doctor, fracture of surgical neck of humerus typically lead to axillary nerve injury. And axillary nerve is important for our abduction, as all of you know. Up to first 15 degrees supraspinatus, 15 to 90 deltoid, and above 90 you need serratus anterior is what you need to basically remember. Neck of fibula, what do you have, doc? You have common peroneal nerve, another very easy question. 5 important points you should remember. Lateral cutaneous nerve of the thigh is meralgia peristoidica. Anterior tarsal tunnel would be deep peroneal, and tarsal tunnel will be tibial. Jogger's foot is medial plantar, hip pointer is iliac crest, and tennis leg is gastrocnemius soleus. Strain is called tennis leg. You might have prepared for tennis elbow. Examiner's first MCQ, if it is tennis leg, that will be little disappointment. That's the reason you must be sure. Okay. Let me wake up the online students. Vijayawada, Neelima, Na, Shweta, everybody. Please shoot your answer, doctor. Excellent. ASD. ASD is the answer. I hope online students can punch the answers for the quiz questions. Yes, Kiran Reddy is also saying ASD. Classically, in ASD में क्या हो जाता? Your left atrial blood entering to right atrium, all right atrial regular blood and shunted blood together will pass from right atrium into right ventricle into pulmonary vessels. So pulmonary plethora will be there. If you do fluoroscopy, it will be like the hilum is dancing, is the feeling that you will get because of the pulmonary plethora. Now doctor, permeability of the water is maximum in the physiology. What is the highest number of questions come from? Nephron physiology. Thick ascending limb में क्या होता? What is countercurrent system? What is the fate of the urea? Who maintains the medullary interstitial osmolarity? All this funda, doctor, you must iron out and go to the exam without any ambiguity. Now doctor, if you take 3 segments, they are called impermeable to water. Easy to remember. 3 जगह impermeable होता है. Ascending limb of loop of Henle which is thin, ascending limb of loop of Henle which is thick, and also the initial part of distal tubule. How will you remember this? Very simple. Ascending, na? If the water is reabsorbed, it cannot ascend. Fountain, what happens to fountain? Water fountain means what? Fountain rises. So water ascends like a fountain because it is not absorbed. And you can remember ascending limb of loop of Henle, there will be water impermeability. Ultimately ascending limb will become the proximal part of the distal tubule. That's the reason proximal distal tubule also will be impermeable part. If at all examiner asks the same question, he will ask. क्या होता है कि एग्जाम जाने के बाद वो डिसेंडिंग है या असेंडिंग है, you will start thinking into sky. Don't do that. Ascending limb, thick and thin, they both are impermeable to water is what you have to remember. Sodium reabsorption is basically decided by what? Aldosterone. Easiest question. What is the action of DNA polymerase 1? It has both 5'3" and 3'5". A common mistake or a misconception in the minds of the students is, अगर 2 antonyms है तो इन दोनों में कोई ना कोई आंसर होगा. एग्जामिनर उतना मासूम नहीं है. Emeteron can lead to development of both hypo and hyperthyroidism. Hypo दिया इसलिए hyper होगा, hyper दिया इसलिए hypo होगा, नहीं होगा. कभी कभी दोनों होगा. तो guessing के लिए भी एक लिमिट होना है. And negative exam में no guessing. Today once more they told online exam will be there. Guys, you polish your shoe and get ready for a fight to join the army. So already once more it is being told. So you should be ready to go for the exam. Now doctor, it doesn't participate in synthesizing a new primer, that is wrong, is what need to be remembered. So helicase unwinds, topoisomerase relieves the torsional strain, DNA primase initiates the synthesis of the new RNA primer, etc., etc. What is the only spokesperson of the cerebellar party? The only spokesperson is Purkinje cell. अगर कोई आउटपुट जाना है बाहर सेरेबेलर कॉर्टेक्स से, खाली Purkinje सेल से जा सकता और कहीं से नहीं जा सकता. So cerebellar histology, physiology is a favorite area for the examiner, which you have to be very sure what is meant by the climbing fibers, basket cells, what neurotransmitters are produced. Today evening only after going home, take out hardly 2 pages, very hard pages, very high yield pages. You can't simply afford to not read that and go for the exam. Chalo, let me ask you another classical question. You are being given a radiograph. It is actually called antler sign. Why it is called antler sign I will not tell. I will not also tell you what is the English Urdu translation of antler. I am giving you one illustration. Stag's antler. So If Stack's antler sign is positive, what is your diagnosis on the plain X-ray? Who to propose an answer? Can Swati, Manasa, Samad, Shweta, Kiran, Shravan, anybody can answer? Yes, doctor. Antler sign. Okay, I'll give one more clue. This you will answer definitely. I'm just checking whether any online students want to try it out. Reverse mustard sign it is also called as, the other name for the antler. KSR has proposed MS, Pragna, Abhiram are all fascinated by MS, mitral stenosis. This is also called reverse mustard sign, where the pulmonary veins will undergo syphilization. Pulmonary venous engorgement will lead to prominence of them towards the apex of the lungs. That syphilization is called reverse mustard, otherwise called antler sign, which is a sign of pulmonary venous congestion, which occurs in case of congestive heart failure. This question was, I think, one of the recent Tamil Nadu or one of the other PG entrants, it was a repeat. Nociceptive stimulation is basically flexor withdrawal. The moment you touch a needle under the skin of the leg, you will withdraw your leg. These are all glycosaminoglycans, but not the chitin. Chitin is basically what? A polysaccharide which is formed by the N-acetyl glucosamine is what you need to remember. Xanthin oxidase, what is the cofactor? One question commonly asked in the exam. Molybdenum is considered to be the cofactor of the xanthin oxidase. Then what reactions in biochemistry occur in cytosol, mitochondria? दोनों में कौन होगा? ये तो वो लिस्ट तो जरूर एक क्वेश्चन आएगा, हाँ? तो डॉक्टर साइटोसॉल में क्या होता है? Glycolysis, glycogenolysis, gluconeogenesis, HMP shunt, fatty acid synthesis, bile acid synthesis, cholesterol synthesis. Cytosol mein. Easy to remember is synthesis, but don't, if you remember synthesis, glycolysis is not synthesis. Glycogenolysis is not synthesis. Otherwise, all other synthetic pathways you can generally remember in cytosol. Then mitochondria में क्या होता है? Breakdown. Krebs cycle, oxidative phosphorylation, fatty acid, beta oxidation, and electron transport. Both mitochondria, cytosol में क्या होता है? Urea synthesis, gluconeogenesis, then protein synthesis, steroid synthesis, and sorting of the proteins. Typically occur in Golgi bodies. I am not talking about these three, I am talking about only these two. Urea synthesis and gluconeogenesis occur in mitochondria and also cytosol. Naturally, examiner's MCQ is within urea cycle which occur in cytosol, which occur in mitochondria, within gluconeogenesis which occur in mitochondria and cytosol. These two are more dangerous because some part of the story occur in, it is like doing MBBS in Karnataka and housemanship in Gandhi. दो जगह होता है, तो क्या कहाँ होता है, you have to be very sure about. Okay, doctor? Now, which amino acid makes major contribution and lead to absorption of light? Generally, amino acids are colorless. Unless they have an aromatic ring, they are not colorful. So, tryptophan, tyrosine, phenylalanine, histidine are the ones which are responsible for the absorption of the color. Oh, this is a... But out of all, majority of the color is because of the tryptophan. This is the beautiful question, doctor. If you answered this correctly, biochemistry aap acha pada. How many of you answered correctly, honestly? Oh, superb, superb. That makes me proud of you. Uncompetitive. Uncompetitive alag hota hai non-competitive se. So what is the difference between uncompetitive and non-competitive? But before that, let me give you one quiz. Please shoot me one confident answer. This is the curve without inhibitor, this is the curve with inhibitor. What type of inhibitor it is? Straight away this image based MCQ will come any entrance you go. You like to say? Superb, competitive inhibitor. So let us be very sure. Competitive inhibitor का मतलब क्या होता है? You and your sister both look alike. So the boy who came to marry is not sure whom to marry, because both can I marry is also an offer he want to try, and he will be thrown out by the father-in-law. Right? So competitive is substrate resembles. Because of that resembles, क्या करना पड़ता? You need to apply little black shade to the younger sister and apply a little more powder to the elder sister and then present. Of course, nowadays younger brother and elder brother are becoming like that. So final velocity, shaadi ek hi hota, it won't get affected. But Kn value become altered. You require more substrate to achieve the half maximal velocity because of the competitive inhibitor, which is substrate wise, which is similar to substrate in its appearance. Non-competitive क्या होता है? The substrate's affinity is not altered. So Km is unaltered. But ultimate velocity which is achieved is decreased. So Vmax is basically altered. Uncompetitive क्या होता है? इसको बोलते हैं anti-competitive. In this, the inhibitor binds only to the complex which is formed between the enzyme and substrate. Enzyme and substrate will meet together. It will go and bind to the complex which is formed by that, and that typically will affect both of them. So Km is lowered and Vmax also become lowered if it is uncompetitive, is what you have to fundamentally understand. Now doctor, what are alpha hemolytic, what are beta hemolytic? You need to be 100% sure. Huh? All of them are. Beta hemolysis is shown by actually beta must be there, right? Sorry, beta was missing. Oh, so sorry about that missing beta. You take it as beta missing. So strep hygiene, Sagalactaceae, aureus, staph, listeria, bacillus, they are all beta. Strep pneumoniae, viridans, mutans, sanguis, entero, they are all alpha. Whole microbiology lies on the pillars of this classification, doctor. If we are answering this question wrong, that shows the leakage in the Titanic ship we are now traveling towards exam. So especially from microbiology perspective. On Vidal test, what are you going to basically test, doctor? Basically antibody titer of O and H, both of them are basically raised. O titer of 1:100 and more, and H titer of 1:200 and more, and a rising titer 4 times rise between two consecutive samples taken 7 to 10 days apart. We also use Vidal for brucella. How it differs from Vidal used for typhoid? In brucellosis, only the O-somatic antigen is the one which is being tested. Coming to poliovirus, what is meant by interference phenomena? One strain of poliovirus will interfere with the infection caused by the other strain. It will prevent the other strain from infecting. That is the whole purpose of giving pulse polio immunization. So then you want to give a vaccine poliovirus to completely eliminate the paralysis causing natural virus out of the body to kill it. So that is the whole idea. It is ether resistant, too much. Will it be alcohol resistant, ether resistant, formalin resistant? How many resistances will you remember? Purely luck based question. You answered wrong, don't worry. Then, which viruses can be cultured using a cell culture system? All of them. But Norwalk virus is not based on cell culture. So how do you basically do? detection of Norwalk. You do by immune electron microscopy, antigen detection immunoassay, nucleic acid amplification in serum antibody, but not by culture. Even TB can be cultured, HIV can be cultured in diagnosis of AIDS is what you know, in newborns. Coming to Cryptococcus neoformans, it is a monomorphic yeast basically, and it is a urease positive yeast is what you need to remember. What are neurotropic organisms which love to go and cause demyelination or a injury to the nervous system? Naegleria, Falciparum, Toxoplasma, they are all called neurotropic organisms is what you have to basically remember. Even Balmuthia is another organism which is considered to be neurotropic organism. Chalo. Take up a quiz, doctor. You are being given a radiograph. Huh? Upper lobe collapse we do know. Generally if upper lobe collapse elderly man mein agar hai to golden S sign is there, it suggests what? What is this upper lobe collapse generally in an elderly person is suggestive of? What is the common cause? Many causes are there for the upper lobe collapse, leading to the S, golden S sign. KSR is proposing Klebsiella. Abhiram and Kiran Reddy, please give one B clap, Dr. B clap, B clap. The B clap of December 31st. They are absolutely right. Even Shweta is right. Lung mass or carcinoma should be suspected, which is responsible for the bronchial obstruction leading to upper lobe collapse is what you have to fundamentally remember. So we are still not sure whether they are going to give only 5 questions, 10 questions, 20 questions or 2 questions. We will be knowing it after they conduct the exam, first time. So that is the reason maybe the number of image based questions we are giving are slightly disproportionately high compared to what may come in exam. So maybe one time examiner delivers the paper, then we can alter it according to the, ये तो पहली बार हो गया ना, examiner के लिए भी पहली बार है, हमारे लिए भी पहली बार है, हाँ? Then orphan diseases का मतलब क्या होता है? Not the ones which come in orphans, for which typically affect very small percentage of population which are rare and most of them are genetic and they are present throughout the person's entire life. So which conditions are called as orphan diseases according to the WHO? Actual JKMD में they asked what are the orphan drugs. वो तो बहुत लंबा लिस्ट है, उसको देकर we don't want to disappoint you. But if at all examiner asks, of all disorders which is the rarest disorder, ribose 5-phosphate isomerase deficiency is called the rarest disorder of all the disorders discovered in the medical knowledge. Now, cystic fibrosis, homozygous familial hypercholesterolemia, Wilson's disease, these are all called orphan diseases is what you have to basically remember. This is a beautiful question, doctor. Volume of distribution depends on what are all the factors is a very important question. It depends on the fat content of an individual, pKa value of the drug and the plasma protein binding. They are all correct. So what is the big list? Suppose if a drug is highly lipid soluble or if it is having a low rate of ionization or if it is having a low plasma binding, obviously what will it do? It will distribute to all tissues. If it is having high lipid solubility, if it is having low amount of ionization and a low plasma binding, and that lead to bigger volume of distribution. Then renal failure will lead to fluid retention and lead to higher volume of distribution. And liver failure, because of the alteration in the plasma protein binding, will affect the volume of distribution, which will get increased if there is a renal failure or liver failure. But if an individual is dehydrated, his plasma volume, hypovolemia will be there, and hence the volume of distribution typically become decreased is what you need to remember. One question on autonomic nervous system pharmacology will be there. So which beta blocker has a potassium blocking effect? 3 important drugs are known to have, in fact 5 important drugs basically affect the potassium channel closers, they are called. Sulfonylureas and repaglinite, they are classically potassium channel closers and lead to hypoglycemic effect by causing the release of the insulin. Then amiodarone, sotalol, bretylium classically are the potassium channel closers which have an antiarrhythmic effect is what you have to ultimately remember. Church-Strauss is reported to occur if you are using which drug? Jafir-Lucast. Unless you don't know this single liner fact, exam mein kuch bhi guess karo, all the 4 look, as such you read it somewhere that their complete sentence will appear before your eyes. Church-Strauss caused by sotalol. As such you are opening the pharmacology textbook, all those hallucinations will come. So don't be carried away with those hallucinations and lose for negative marks. Now doctor, albumin, alpha-1 acid glycoprotein. These are the 2 subsets of drugs which are known to bind with the, these 2 subsets of proteins bind with the drugs. I think online students, can you please punch whether the voice is loud and clear, because we lost the power in Hyderabad. Yeah, so for some time you need to attend the class in the darkness, but is the voice clear? Yeah, please bear with us. So doctor, orosomucoid is also alpha-1 acid glycoprotein. So basically it is also an acute phase reactant, and in some situations the plasma levels of the alpha-1 glycoprotein get affected, pregnancy, HIV infection, etc., etc. So which subset of drugs bind with it? Typically those which are positively charged, which are basic pK wise, they are the ones which will bind with alpha-1 acid glycoprotein. Whereas the acidic drug which are negatively charged and also the neutral drugs, steroids, protease inhibitors, they all basically bind with the albumin. Any person who is hypoalbuminemic typically will ultimately get affected. So beta blockers, prazosin, lidocaine, imipramine, verapamil, bupivacaine, quinidine, painful list, not related one to the other. They are all bound with alpha-1 acid glycoprotein. I think this is the easiest question on the planet. Which is a protease inhibitor? Identify it, we will pass you. JKMD. Nelfinabir is the one. So doctor, 2 to 3 questions on antiretrovirals, sometimes 1 or 2, but definitely 1 or 2 will come. You have to be 100% sure. So basically reverse transcriptase inhibitors are the main group of antiretrovirals. They are being divided into non-nucleotide and nucleotide, and within nucleotide they are divided into nucleoside, nucleotide. Ultimately nucleotide need to get converted into nucleoside, but there are 2 drugs which are directly nucleoside without the requirement of any conversion. So what are they? Nucleoside analogs, means they should be either thymidine, cytidine, guanosine, adenosine, any of these analogs. What are thymidine analogs? Zidovudine, stavudine. Cytidine analogs are lamivudine and emtricitabine. Then guanosine analog will be abacavir, and adenosine analog will be diadenosine, and tenofovir is what need to be basically remembered. Then tenofovir and edifovir, they are not nucleotide, they are directly nucleoside, is what you have to ultimately remember. Then what are non-nucleoside? If I have arranged nevirapine, dilaudidine, then rilpivirine and etrapivirine is what need to be remembered. All virs, most of the virs are all protease inhibitors. Sakinavir, nelfinavir, indinavir, ritonavir, tiprinavir, etc., etc. So that's what you need to remember. Now let me test how much you are HIV compatible. Enfuvirtide is fusion inhibitor, I don't know. Which GP? GP number क्या होता है? Maraviroc blocks which GP? वो बताओ. GP 120 is which one? Enfuvirtide, you think? Okay. Then what should Maraviroc? Huh? G? That's right. Co-receptor. But what is the main GP receptor which ultimately get affected by the blocking of that co-receptor? Which GP? GP is 40, Maraviroc, Enfuvirtide you want to say 120. Let me find out. Shweta says CCR5, CCR5 for Maraviroc, but which GP? So, doctor, Enfuvirtide is 41. Okay, Enfuvirtide is 41. CCR5 receptor inhibitor, Maraviroc is the one which is GP 120. So, favorite question of the examiner. You can't afford to do a mistake when it comes in the tomorrow's exam. So, type 1 helper cells basically produce what? Interleukin 2 classically is produced from the activated CD4 plus T cells is what you need to remember. Then IL-1 causes fever, IL-2 causes T cell stimulation, IL-3 is bone marrow stimulation, IL-4 is IgE stimulation, IL-5 is IgA stimulation. So this Suprabhatam you have to interleukin Suprabhatam, so morning only you have to revise every day until exam. Edison में क्या नहीं होगा? Edison में नहीं होगा abdominal striae. Abdominal striae are the feature of Cushing's is what you have to basically remember. Then hyperpigmentation, hypotension, in spite of giving fluids, BP does not rise. That is the story which you see in case of Edison's disease. What is the function of liposomes? They transport the lipoproteins basically. And that's how we give amphotericin etc. as liposomal preparation. Where do you see Russell body, doctor? Russell body is typically seen in multiple myeloma. So this is the plasma cell, and this is that excessive immunoglobulin which is being produced will lead to formation of Russell bodies is what need to be remembered. Iron deficiency hai to, unless you treat with iron, reticulocyte doesn't increase. On treatment, it will increase. What are the other features? Since iron is not incorporating into protoporphyrin to form porphyrin, protoporphyrin remains as protoporphyrin and erythrocyte protoporphyrin levels will typically increase is what you need to remember. Then, megaloblastic anemia mein kya ho jata? Bone marrow ka cellularity. Typically it becomes hyperplastic and megaloblastic bone marrow. Whenever megaloblastic anemia is there is an ineffective erythropoiesis. The moment RBC is produced, it is broken down by our own bone marrow before it is released. So to compensate for that anemia, what will bone marrow will do? It will try to become much more hyperplastic is what you need to remember. This is how a bone marrow of a megaloblastic anemic individual which is hyperplastic typically will look like with megakaryoblast cells. When will you do exhumation in India? There is no time limit. When can you do post-graduation in India? There is no time limit. So be very sure. Any time you get doctor, it is worth it. That two dangling letters, MS, MD, DM, either MCH or DCH, anything is good. For common man in village, both of them are equally good degrees. So, in fact, DCH is very popular. MCH बोले तो कोई नहीं समझेगा अगर आप जनगाम आलेर गए तो. So, in autopsy, what are the best site to take for toxicological analysis? Heart. Typically, blood from the heart serves as a very good source. Whenever there is a lightening, what happens? Like a arborescent tree, right? So they are called filigree burns, is what you typically call arborescent burns. Can close that door. Yeah, is what you need to basically remember. Then doctor, which is not a sexual perversion? Beautiful question. This is one question. Lot of state PG entrances they will commonly confuse you on this. For that you must be expert in sexual offences. Sexual perversions, natural sexual offences, unnatural sexual offences. That's how we have divided. Perversions hota hai without any penetration, without any intercourse, there is a sexual gratification and satisfaction. Wo hota hai perversion. By wearing opposite sex dress or by touching somebody and getting or publicly giving a display, there is no intercourse involved in perversions. Sadism, masochism, fetishism, exhibitionism, transvestism, voyeurism, etc., etc. Then what are called natural sexual offences? In some countries incest is punishable, in some countries it is not. So incest, rape, adultery. But rape is punishable in any country. You can't tell judge, sorry, I don't know, in this country rape is a crime. You can't plead. Rape is a crime in any country you go. Then what are unnatural sexual offences? Which are against the order, voluntary sexual intercourse against the order of the nature with any man or a woman or even an animal become unnatural. So tribadism, that is lesbianism, bestiality, sin of Gomorrah, sodomy, etc., etc. They are against the order of the nature and they become the unnatural sexual offences. So now you are very sure, doctor, what is the correct answer? Why can't it be? B, pedophilia was also there. Oh, I'm sorry, I didn't observe that. So then B and D become the answers, right? So pedophilia, fellatio, both of them are considered to be, because sodomy is included under unnatural sexual offences, agreed. Hemodialysis, in which poisoning do you basically use, is a very important question. What should be the property for any given drug to be dialysable? First, it should have low molecular mass. Second, high water solubility. It should have low protein binding, and it need to have a prolonged elimination and a long half-life, and it should have a small volume of distribution. What will lead to confusion for you? Earlier we said volume of distribution will be low if protein binding is high, but small volume of distribution is good, but a low protein binding is also good for a drug to be dialyzed. But don't confuse. If the small volume of distribution is not because of high protein binding, there are other reasons for small volume of distribution, like high water solubility and a low lipid solubility, then such a drug is more dialysable. So what drugs are dialysable? Ethylene glycol, then procainamide, methanol, barbiturates, lithium, sotalol, ethanol, theophylline, salicylates, they are all the dialysable toxins. Now comes the question, doctor. Even if you are in Jammu Kashmir, in the middle of Himalayas, what is the corrective effective temperature? आपको पढ़ना ही पड़ेगा, हाँ? तो pleasant and cool, comfortable, extremely hot, intolerably hot. One inevitable, useless list, which has nothing to do with what type of PG you will do, except PG in SPM, right? But still, you have to pass through the drilling exercise of remembering the table, which can be one of the repeatedly asked questions. Number of IFA tablets are how many? 100. So, a adult tablet contains 100 mg elemental iron, 500 micrograms of folate given for a minimum of 100 days. And a pediatric tablet contains 20 milligram elemental iron, 100 micrograms of folate to be given for 100 days minimum, is what you have to ultimately remember. Millennium Developmental Goals, 2015 tak a topic they will definitely ask, what are the indicators which say that you have achieved it sufficiently? Under 5 mortality, infant mortality and proportion of 1-year-old children who are immunized against measles, they are all included. Then what is goal 5? To improve the maternal health. And what are the parameters based on which you will know the efficiency? Maternal mortality ratio and the proportions of the births attended by the skilled health personnel. They are the indicators to say whether you have achieved the improvement of maternal health or not. Who proposed social medicine? History of medicine is important. Only knowing diabetic ketoacidosis clinical management is not enough to get a seat in MD doctor. Little quiz. Kaun banega karodpati. So Julius Guerin in 1848 introduced social medicine is what you have to basically remember. 35-year-old known case of multibacillary leprosy develops ulcers. What do you like to term it as? Basically you have different definitions which you should know. What is impairment? Any loss or abnormality, psychological, physiological, anatomical, basically is called impairment. The moment that is causing inability to perform an activity considered to be normal for a human being, then you call as disability, right? Then handicap. If it is a disadvantage for a given individual from that impairment or disability that limits him to play the normal role in the fulfillment of the role which is normal for that individual, then that becomes the handicap. Then there are 2 types of disabilities, primary, secondary. Primary क्या होता है? Paraplegia, for example, which occur after spinal cord injury is called as primary. But what is called secondary? Later on, due to that immobility, due to paraplegia, if improper physiotherapy is there, the patient will develop contractures. That become secondary. यहाँ भी क्या हो गया? Multibacillary leprosy is primary disability. But because of that, he has developed a plantar ulcers. That is basically called secondary impairment is what you have to ultimately remember. Oh doctor, कलम पकड़ के पेपर के ऊपर कैलकुलेशन बनाने का वक्त आ गया. So you have been given different ESR values and asked to find out standard deviation. If you know the formula, you are in. If you don't know the formula, you are out. If there is no negative marking, you can take out that red ant you are carrying. What is that red ant hypothesis? Leave the ant wherever it stops, pick up the answer among ABCD. Okay, so that is the only thing that you have to do if no negative marking. So doctor, what is the way? These are the 8 data points. You add all of them and divide by the 8, that will give you the mean value. Then you subtract from each of them the mean value and square it up. And whatever the squared values you got, you add them up. Divided by total values 8. Square root of it is equal to 2. 2 becomes the answer. Right? So easy question, but you need to know the formula. Adverse events following immunization. What brings the greatest discredit to all immunization programs? For example, poliomyelitis. Vaccine associated poliomyelitis will bring all discredit. Right? What kind of discredit? District medical health officer will shift from one district to other. He will be transferred. Then ultimately minister will give 1 or 2 interviews that it is all because of DMHO. DMHO will say all because of the PLC doctor, all because of the ANM, and all because of ultimately we don't know. They will put a committee and that will be forgotten after 1 week of newspapers. Right? So WHO clearly said what kind of adverse event should be reported. All need not be reported. Right? So usually you will restrict for the adverse events occurring within 3 months of immunization, most of the times. And most of the scenarios, adverse events are because of they occur within 3 months, most of the times, except 1 or 2 cases. I'll come to that list also. So, all to be reported is wrong. There are some criteria to report. So, for example, if you have got Guillain-Barré syndrome, it should be reported within 3 months. Otherwise, all the AFIs have to be reported. Doctor, except is missing, sorry. Actually, original question, except is missing, okay. Alright. So, these are the some of the important adverse effects which can occur, and what type of reactions need to be reported also is important. I leave the literature for you to review. Okay. Now, which vaccine can be reused? Oral polio, provided that monitor is saying that it is not damaged, you can reuse it. Remaining things need to be basically discarded within 1 hour most of the times. Attrition is not a problem in which situation? In case control, because 10 cases in ward number 1, 10 cases your neighbors in the apartment. You will calculate their BP and present a PG thesis. So your apartment means you can lock the door and prevent them from leaving the study. Mera MD ka final exam hai, please don't leave is what you will ask. Then your own patient's ward means you can go to their home and also sit and prevent attrition. Cohort is not like that. Cohort is a group of population. Some will leave to America for job, some will take USMLE and leave. So finally, by the time end of the study, you will have very few people from the original population you planned. That's the challenge. Positive predictive value depends on prevalence, sensitivity, specificity. You must know the formula. Don't forget, doctor. Sensitivity into prevalence divided by sensitivity into prevalence plus 1 minus specificity into 1 minus prevalence will give you positive predictive value. Many times we discuss this. Immunocompromised may all this will occur. Klebsiella is not considered to be an opportunistic infection specifically. Then coming to the health education, what is incorrect? There are two things, doctor: health education and propaganda or publicity. So, if you appeal to the reason, that is called health education. If you appeal to the emotion, then that becomes publicity and propaganda. For example, family planning. Family planning. So, suppose you give one nice speech. Generally, minister will do health education or propaganda. So, generally politicians are good orators who touch the emotional level. But as a doctor, you are supposed to touch at least the level of reasoning and make the person accept what you are doing on him. Then, renal stones can be side effect of which drug? This is a beautiful question on anti-epileptics. Definitely a question will be asked on anti-epileptics. Topiramate. Why topiramate? Topiramate is carbonic anhydrase inhibitor. Because of that, two side effects occur. If it is a carbonic anhydrase inhibitor, क्या हो जाता? Bicarbonate reabsorption get affected, and bicarbonate will be lost into urine, and the bicarbonate will affect citrate. Citrate will affect calcium and oxalate, and ultimately that precipitates stone formation. So topiramate can lead to stone formation, and topiramate can lead to slight metabolic acidosis. So both of them can be the complications. And also another important problem with topiramate, don't forget, doctor, it can lead to acute myopia, and it can also lead to secondary angle closure glaucoma. Can be one of the side effects of the topiramate, is what I want to underscore to all of you. Your entire December 31st night, if you spend on epilepsy and anti-epileptics also, it is worth it, doctor. 5 to 6 hours spending on, there are some topics which don't deserve your tears. Don't cry for them. Right? There are some topics which need your attention. Like a kwashiorkor baby requires the mom to take care of him. And don't ignore them. And don't tell, I don't have time for it. If you don't have time for it, why did you apply for exam? So you need to have time for it. Just review if you did this wrong. Then what are the contraindications for tissue plasminogen activator administration? Platelet count is supposed to be more than 1 lakh. If it is less than 1 lakh, that becomes the contraindication, and there is a big list. Hematocrit less than 25%, glucose less than 50 or more than 400, use of heparin within 48 hours. Early morning you must read all this so loudly that your roommate should not feel like sleeping, not eating breakfast. He must go into anorexia. So that is very, very important, right? One of our friends during preparation days, Kiran, is the guy, while going to the bed after the day-long preparation, he used to jump onto the bed and sleep. And sleeping also, instantly he used to go to sleep. Then getting up also, he used to get up, make a big noise, and then start. He used to say, what is this, Kiran? Have some human this thing. No. To be fully vibrant is all about preparation. I am worried that if I become little slow, some thoughts will come. Why I did not get seat, all my friends got seat. And slowly from there I will break out. So to avoid that, he used to be in a high velocity. His reading also, Harrison used to be like zoom, 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 zoom. All pages he used to turn like anything. Ultimately he did MD General Medicine. He is a top rheumatologist. So what I want to tell you is next 100 days you should be sprinting with enthusiasm. You must be sprinting what you are going to do at the end of 100 days. You must be sprinting with only one dream, which is only positive, that you are the postgraduate of the 2015 Millennium Developmental Goals. Okay, so that's the only spirit with which you work, doctor. You will definitely get seat. Okay, then lateral medullary syndrome. Simple question. Spinothalamic tract from the body will already finish its contralateral decussation at spinal cord level only. So contralateral loss of pain and temperature will be there. But trigeminal will supply ipsilaterally. That's the reason ipsilateral facial sensory loss and contralateral pain and temperature of the body are the features of the lateral medullary syndrome is what you have to ultimately remember. Now doctor, I told you na, Ek Weber, Nothnagel, Parinod, Benedict. You will remember me in exam hall. अरे ये कितने बार हमने डिस्कस किया. Wednesday, Sunday, Wednesday, Sunday. For me also it has become like back to back, back to back. After going home, my next job is to prepare the Sunday paper. Right. So we will finish in next 20 papers, 4,000 questions which we are going to discuss. Most of the issues will be settled. What is going to come in entrance? Only thing is you need to react after going home for what you have done wrong. So clots, basically there is a development of oculomotor nerve palsy, hence levator palpebrae superioris is affected, hence there is a ptosis. So what is the combination? Oculomotor palsy, contralateral hemiparesis, and there is a contralateral ataxia and contralateral hemiplegia of the lower face, which is of the UMN type due to the interruption of the corticobulbar fibers. I know I am going too fast, but brainstem stroke is one topic in anatomy to medicine video library, doctor. Just review. Then I have discussed all these topics, etc., etc. So these are the important structures damage leading to the respective effects whenever there is a clot syndrome. What is not reversible dementia? Any vascular dementia is not reversible. So Binswanger's disease is the one which is basically a vascular dementia. But vasculitis is reversible. You give steroid, bring down inflammation in the vessel, then the dementia is reversible. Any endocrine dysfunction, metabolic abnormality like hyponatremia or any vitamin B12 deficiency, early stage if you discovered, they are all reversible causes of the dementia is what you need to basically remember. There is a lymphocytic pleocytosis. What cannot be the answer? I mean, what cannot be possibility? Pyogenic meningitis, because pyogenic meningitis has neutrophilic predominance. Caricum marba, where do you see? We see in case of acute rheumatic fever. Acute rheumatic fever, not chronic rheumatic fever with a valvular abnormality. But acute rheumatic fever, when there is a cardiomegaly, valvulitis, that lead to development of Carey-Combe murmur. Carey-Combe murmur क्यों होता है? Basically, what type of murmur? It is a short mid-diastolic murmur. The moment valvulitis improves, even that will also disappear. And it is associated with the S3 gallop. It is associated with cardiomegaly, which occurs due to acute carditis in rheumatic fever. तब होता है. हाँ, this is one important thing, doctor. Please give me the board. Yeah. So typically what happens is, your mitral valve is there between left atrium and left ventricle. Acute carditis हो गया, heart का shape ऐसा हो गया. From here it became this big, and that has stretched this ring, right? And what happens in this scenario? The left ventricle, because the carditis has failed, and there is a increased circulation across, rapid circulation across a edematous valve which has suffered valvulitis with a dilated ring, and that is responsible for the mid-diastolic rumble which you listen whenever there is acute carditis. But suppose if it became stenotic, right? If it became stenotic mitral valve, then also you will listen what? Normal flow across a stenotic valve also leads to murmur. Carey-Combe is because of increased, rapid circulation against a edematous valve is the one which is responsible with a valvular dilatation. उसमें opening snap नहीं होगा, मगर mitral stenosis में opening snap होगा. And pure mitral stenosis में never you will find S3. But S3 presence is a feature of Carey-Combe. That is the fundamental difference between the two, is what you need to remember. Now doctor, Austin Flint, Graham Steele, mean, Latchman scratch, Siegel murmur. So all these murmurology, you have to be 100% sure. Oh, one dyslipidemia without any ECG, that sense of satiety doesn't come in entrance. Still, if you are doing ECG dyslipidemia questions wrong, in spite of taking 10 papers of us, means I am failing in my job, doctor. To inspire you to read the common ECG findings in hypo, kalemia, calcemia, magnesemia, luckily no natremia. Then, so what do you have, doctor? First peak T waves. When will they appear? When potassium level is 6. Second to appear is prolongation of PR interval. When will it appear? When potassium is 7. And third is absent P wave with a wide QRS, sine wave pattern. If the patient is still alive, 8 to 9 milliequivalents is what you need to basically remember. One question on antiarrhythmics. Classification will be asked, doctor. Flecainide is not class 3. What is 1A, 1B, 1C? And also last time I asked a question. Action potential duration increased, decreased, normal. 3 varieties, 1A, 1B, 1C. Quinidine, procainamide, disopyramide are 1A. Lidocaine, mexiletine, phenytoin is 1B. Flecainide, encainide, propafenone, they are all basically what? 1C is what you have to basically remember. Then what you will not see in constitutive pericarditis? Constitutive pericarditis and pericardial effusion and cardiac tamponade. JVP, what is the difference? Is a favorite topic. Any entrance, Jammu से आप न्यूयॉर्क सिटी जाओ कहीं भी, तो prominent Y descent is not a feature. So rapid Y descent is a feature. Sorry, prominent Y descent or rapid is a feature. Which one? Constitutive pericarditis. No, okay. Pulsus paradox is a feature of tamponade, but not generally constitutive pericarditis. That's what you need to basically remember. Tamponade may how will be Y descent? Absent Y descent will be there. Because diastole time में क्या होता? Ventricle collapses. There is no filling into the ventricle that will occur. Unless atrium fills into ventricle, atrial pressure will not fall down. Y descent doesn't occur. Hence, absent Y descent is a feature of the cardiac tamponade, is what you need to remember. Chromoline is the mast cell stabilizer. I told you na, ABPA. Allergic bronchopulmonary aspergillosis, eosinophilia syndrome, eosinophilia, myalgia syndrome. What are the major minor criteria? Favorite topic of examiners. So on Sunday, once Maharashtra NEETPG MCET is over, we will have 300 MCQs of what examiner is nowadays breeding and brooding with, and we will have a review of them in the form of a mock test, so that you will discover that entrance preparation is so easy. If you know 50% of 11-20 topics, at least if you read, still you will get 80% marks and be in the top 50 ranks. That is the goal. Okay, doctor? So, it is not peripheral bronchiectasis, it is central. I will show you. Central bronchiectasis is the nature of the allergic bronchopulmonary aspergillosis. You can see the dilated bronchi, doctor. Central aspergillosis is the feature which you need to fundamentally remember. I am very happy to see even on the last day of the year we have 65 plus online audience with another 100 to 150 available in various centers across the country. So doctor, what are the major criteria of ABPA? Asthma, infiltrates, eosinophilia, wheel and flare to the aspergillus antigen, and Presbyterian test, elevated IgE, central bronchiectasis. They are all called major. HIV nephropathy को क्या is characterized by what? Collapsing glomerulopathy it is called. It is one of the variant of FSGS, focal segmental glomerulosclerosis. It is one of the variant. Our favorite topic आ गया, Bartter, Liddle, Gitelman. Without that, and Conn syndrome. Without that, there is no paper. Bartter is equivalent to what? Giving loop diuretic. Loop diuretic loses the calcium. That's the reason what you have? Hypercalciuria that predisposes to nephrocalcinosis. But how will be the BP? BP will be normal or low but not hypertension. And hypokalemia will be there, in metabolic alkalosis will be there. Gitelman is equivalent to what? Thiazide diuretic. And what else? Liddle. Liddle is like hyperaldosteronism. Without aldosterone only, there is a constitutive activation of the sodium channel is what need to be remembered. So these are the few JKMD questions which we wanted to give you the feeling of the old questions, doctor.